would like to inform you all today about anemia. Anemia is a condition in which your blood has a lower than normal number of red blood cells. Now I'd like to tell you all the causes, symptoms, and treatment for anemia. Anemia could be a result of the loss of blood, lack of red blood cell lack of red blood cell production, or high rates of red blood cell destruction. Some major signs of anemia are weaknesses and fatigue. These signs usually occur when the red blood cell loses their capacity to carry enough iron to work muscle. Lack of iron can affect the tongue by making it sore or swollen, and sometimes cracks may also occur in the sides of the mouth. As for the fingernails, they grow abnormally, becoming spoon-like in appearance, and slightly anemic. The main signs may be the skin getting mildly paler than usual and decrease in the color of the lips and gums, but they are hard to detect. Since these changes occur gradually, they are hard to detect. Some of the other unusual signs and symptoms of anemia include lightheadedness, rapid heartbeat, frequent infection, cold feet and hands, the nails becoming brittle, irritability, and large motor spleen. Depending on the cause of anemia, the symptoms could also include jaundice, the white of the eye may become yellow, and the urine could be darker, like a tea-like color. Since the body stores of iron are usually depleted slowly, many people with iron deficiency may not show any signs and symptoms of anemia. As the condition progresses, the above mentioned signs may be recognized, while mild anemia may have no obvious symptoms, and anemia, some anemia, certain specific types of anemia have specific recognizable symptoms, like the pain that accompanies sickle cell anemia, or as in the case of iron deficiency anemia, usually cravings for non-food stuff like dirt, ice, and starch. And treatment, if you have anemia and it's like a mild case of anemia, your doctor will prescribe some sulfate phosphorus pills. They like some little green pills that you have to take like maybe two times a day, and then it gets better, but you can't have too much caffeine because that like decreases your I guess it's the hemoglobin in your blood. It decreases it. So, but you'll have to take at least one a day. And that concludes the end of my speech of anemia.